Hi everyone, welcome back to my YouTube channel, and today we are going to talk about myocardial infarction. So let's start the topic with introduction. Myocardial infarction, commonly known as heart attack, is a serious and life-threatening condition that occurs when the blood supply to part of heart muscle is suddenly blocked. The interruption in blood flow leads to ischemia and necrosis of myocardial tissue. Myocardial infarction is a major cause of morbidity and mortality worldwide and requires immediate medical attention. Definition: Myocardial infarction is defined as irreversible death of heart muscle tissue resulting from prolonged lack of oxygen supply due to obstruction of one or more coronary arteries. Etiology of myocardial infarction: The most common cause of myocardial infarction is coronary artery thrombosis due to rupture of an atherosclerotic block. Other causes include severe coronary artery spasm, embolism of coronary arteries, severe hypotension, severe anemia, cocaine or drug-induced vasospasm, congenital coronary artery abnormalities. Risk factors are two types: modifiable and non-modifiable. Non-modifiable factors include increasing age, male gender, family history of cardiovascular disease, and genetic predisposition. Modifiable risk factors include smoking, hypertension, diabetes mellitus, hyperlipidemia, obesity, sedentary lifestyle, stress, and excessive alcohol intake. Pathophysiology: Myocardial infarction usually begins with the rupture of atherosclerotic plaque in the coronary artery. This rupture exposes the underlying lipid core, triggering platelet aggregation and thrombus formation. The resulting clot obstructs blood flow, leading to myocardial ischemia. Ischemia persists for more than 20 to 30 minutes. Irreversible myocardial cell death occurs then. The affected area undergo inflammation, healing, and eventually scar formation. Types: There are two types. First is ST segment elevation myocardial infarction, that is complete occlusion of coronary artery. Second type is non-ST segment elevation myocardial infarction, that is partial occlusion of coronary artery. Clinical manifestation: Common signs and symptoms include severe persistent chest pain or pressure, pain radiating to the left arm, neck, jaw, back, or epigastrium, shortness of breath, profuse sweating, nausea and vomiting, anxiety and feeling of impending doom, fatigue, and palpitation. Diagnostic investigation: Diagnosis of myocardial infarction is based on clinical features, ECG changes, and laboratory findings. They include ECG, that is electrocardiogram, cardiac biomarkers such as troponin and CKMB, echocardiography, coronary angiography, and chest X-ray. Management: Immediate and effective management is crucial to minimize myocardial damage. Emergency management include oxygen therapy, aspirin and antiplatelet agent, nitroglycerin, morphine for pain relief, and beta blockers if indicated. Then there are medical management that include anticoagulants, thrombolytic therapy, statins, ACE inhibitor or ARB, calcium channel blocker in selected cases. Then there is surgical and interventional management that include percutaneous coronary intervention and coronary artery bypass graft surgery. Complications of myocardial infarction: If untreated or treated late, it can cause cardiac arrhythmias, heart failure, cardiogenic shock, ventricular rupture, papillary muscle dysfunction, pericarditis, and sudden cardiac death. Rehabilitation and lifestyle modification. Cardiac rehabilitation play an important role in recovery. It includes gradual physical activity, smoking cessation, heart healthy diet, stress management, regular follow-up, and medication adherence. Prevention of myocardial infarction. Preventive measures include control of blood pressure, blood sugar, and cholesterol, healthy diet and regular exercise, avoidance of smoking and alcohol abuse, and regular medical checkups. Conclusion of this lecture video: Myocardial infarction is a medical emergency that results from prolonged interruption of blood supply out to the heart muscle. Early recognition, prompt treatment, and long-term lifestyle modification significantly improve survival and quality of life. Preventive strategies are essential to reduce the incidence and complication of myocardial infarction. And this was all about myocardial infarction. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.